Have you had abdominal or pelvic surgery and things just don't feel right down there? That's okay. I'm gonna walk you through this. I'm Pauli, a women's health physical therapist, and this is Beyond the V Women's Health. I am on a mission to shed light on the lack of care, the lack of conversation about these uncomfortable topics, and to create resources for you and provide help. I created this channel because no mom or woman should have to struggle when there are answers. So the unfortunate thing is that scar tissue does not always stay local. So if you fall into this category, if you've had your gallbladder removed, your appendix moved, if you've had a hymenectomy, if you've had some bladder surgery, if you had your uterus removed, if you've had any other abdominal or pelvic surgery that might fall into this category, then these are considerations that you should think about. The way I like to describe it to people is it's as if the doctor, before he sews you up, drops a bunch of super glue in your tissues and hopes that things move really well. The thing is with our stomach is we have, or our abdominal organs, is we have a covering called the viscera. That viscera is really slick. So that allows all your organs to slide and glide. Because if you think about how much content we actually have inside of our stomach and our pelvic cavity, there's a lot of things. So that covering, that viscera, allows everything to slide and glide and move. So when I go to bend over, my gallbladder, my appendix, my uterus, all that with the pressure, things are sliding and gliding like they're supposed to. However, if I have super glue because I had an abdominal surgery, that's going to impact or allow some of my organs not to move very well. Does this sound like you yet? Stay tuned. So if this is you, there are some things that you can do. My two recommendations are to, one, see a pelvic floor PT, but the second one is to see a pelvic floor PT who knows how to do visceral mobilization, or there are massage therapists that can do visceral mobilization. So let me walk you through that. What someone is doing when they're doing visceral is they're literally taking your organs and they're coaxing them to move so that they can slide and glide like they're supposed to, so that your organs are doing and moving like they're supposed to allow you to have better range of motion, meaning you might be able to bend over and touch your toes a little bit easier. You might be able to reach behind you in the car to reach for something a little bit easier because all those organs are sliding and gliding. There's so many benefits to doing it. The other consideration to go see a pelvic floor PT if you've had an abdominal or a pelvic surgery is because even if you've had an abdominal surgery, your pelvic floor could be affected. And so I want to make sure, or rather make sure that you know the importance of your pelvic floor being able to move through its appropriate range of motion. So if you're new here, our pelvic floor should be able to contract, relax, and then it should be able to lengthen. But if we have scar tissue blocking it and we're not letting those muscles move like they're supposed to, it's not going to allow our muscles to do their job so that we're not leaking everywhere, whether that's our urine or our stool. But it's also going to potentially mean that our muscles might not be doing what they're supposed to for intercourse. So seeing a pelvic floor PT, they can help you walk through that process. I know there's a lot of considerations here that if you have this surgery, or maybe I didn't mention your surgery, but maybe you don't have the problems that I've listed or talked about, it still would be beneficial to see somebody. I am changing the conversation on women's health and I need your help. Like, subscribe, and hit the notification bell below so you know when there's new videos. And share these videos with friends or other women that you know will benefit from this information. And for more resources, check the description box below.